What is up, guys? Today I'm going to go over 3 different complications of portal hypertension. And as always, this video is for educational and informational purposes only. This is by no means medical advice. For all medical advice, please see your healthcare provider. Portal hypertension commonly arises as a complication of cirrhosis. Now, I'll remind you that the liver has a dual blood supply. It has its normal blood supply from the hepatic artery, which carries rich oxygenated blood to the liver, and it has another blood supply through the portal vein, which drains venous blood from much of the GI tract and the spleen. It's this portal blood flow that allows a lot of the nutrients and metabolic byproducts that come from the GI tract to go directly to the liver where they can be processed. Cirrhosis is when the liver becomes scarred and fibrotic, instead of smooth and healthy. Here we can see a biopsy or a sample of a cirrhotic liver under the microscope. All of these pink nodules are liver parenchyma, and all of this purple stuff, these are all bands of fibrosis. This is collagen being stained purple by a trichrome stain. This is all the scar tissue that we're talking about. On a side note, if you just address the underlying cause, you can find that over time the body will repair all of those fibrotic bands, and eventually they'll shrink down. And it's actually astonishing how much hepatic function can be recovered if one does something as simple as just abstaining from heavy alcohol use. This scar tissue in the liver will actually compress the blood vessels and sinusoids that are running through the liver. This can cause essentially a physical resistance to blood flow that backs up into the portal circulation, raising portal blood pressures. The process of cirrhosis also damages the endothelial cells within the hepatic sinusoids. Endothelial cells line the inside of all blood vessels and play an important role in regulating vascular tone. Combine this with the fact that vasodilators like nitrous oxide are downregulated within the liver and upregulated within the portal venous system. This leads to more blood and volume pooling within the portal venous system, leading to increased portal hypertension. Lastly, the inflammation within the liver that's driving the underlying injurious process that's causing the cirrhosis is leading to the upregulation of enzymes like cyclooxygenase that produce things like thromboxane A2, which are potent vasoconstrictors and will cause the hepatic vasculature and the blood running through the liver to clamp down even more, which even worsens the portal hypertension. So now that we understand why portal hypertension happens in cirrhosis, now we can discuss some of the complications. One complication of portal hypertension is esophageal varices. Esophageal varices are dilated esophageal veins that connect the portal and systemic circulation. This is via the left gastric vein and the esophageal veins. And then the varices would develop right in the middle, right here. Think of these shunts as fail-safes that essentially open up in order to relieve pressure. This is the picture of the inside of an esophagus, and we can see some of the varices right here. These are problematic because they're close to the surface and extremely fragile. This can cause them to rupture, resulting in massive bleeding, which can be life-threatening. Portal hypertension can also cause ascites, which is accumulation of fluid in the peritoneal cavity, or basically the belly. This happens because of the elevated pressures, volume, and inflammation within the portal venous system. The increased pressure as well as the increased vessel wall permeability allows fluid to literally leak out of the vessels right into the belly. In addition to just being uncomfortable, this fluid can also become infected, which can lead to life-threatening peritonitis. Another complication of portal hypertension is hepatorenal. In essence, hepatorenal syndrome is kidney failure being caused by cirrhosis. I actually have a whole video explaining hepatorenal syndrome, but very briefly, splanchnic vasodilation in portal hypertension leads to blood pooling in the splanchnic circulation, and it lowers renal perfusion. The kidney then tries to adapt by retaining more water and sodium and trying to pump up blood volume and blood pressure. But this has the end effect of just worsening the splanchnic vasodilation and blood pooling and just making the whole entire problem even worse, kind of leading to a positive feedback loop, where the kidney gets less and less blood flow. Thank you so much for watching. As always, this video is not medical advice. This was just for educational purposes only. Please consult your healthcare provider for any questions about medical advice. Thank you for watching. Make sure to drop a comment down below if you have any questions. See you later.